This meeting is being recorded.
Hey guys, welcome back to my YouTube video channel. I am honored and excited to bring Dr. Lorin Berland on my show today. You guys will learn a lot of things that a lot of us been practicing dentistry for many years, and we have no clue what's going on with certain things that we're doing for our patient, especially denture patient, appliance use. I'm jumping right in, and I like to just introduce Dr. Berland with some description about who is he. So allow me to read Dr. Berland short information about who is he. Dr. Berland been one of the most published author on clinical dentistry and dental education, over 100 articles written, and best-selling books and instructional video, including best-selling Lorin Library Smile Guide. If you guys haven't seen or heard him talking about the Library Smile Guide, you guys should check it out. Dr. Berland was recognized by the American Academy of Cosmetic Dentistry for outstanding contribution to art and science of cosmetic dentistry, and have been featured for major national print and TV publication for his work. He is even accredited as an early pioneer of dental spa concept. You guys been using it, the dental spa concept? He is the one that begin with. Dr. Berland begin his career at the denture technician, and even more than after 40 years of treating and listening to his patient and running the Dallas Dental Arts, a successful multi-specialty practice. He has been released lines of product, especially in these design for to help treat most common yet serious affected people with oral appliance, like oral infection, dry mouth, sore spot, and many other major problems that his product can help. Dr. Berland, I am honored and excited to bring you on my talk show today. Welcome, Dr. Berland.
Well, thank you. Thank you. It's a pleasure being here. I wish I was where you are. It looks like you're in Hawaii or something.
I wish. I'm in California. Still
Oh,
not bad.
that's
Yeah.
close enough. That's
Yeah.
close enough.
How your
So,
day?
pretty good. I've been listening to, a lot of your interviews. You've had all the luminaries, Ed Zuckerberg, Marty, Howard Ferran, Emily Latran. You've had them all.
I am honored to
This
have
is a
you.
big honor.
I am honored to have you. I'm excited because just like you, but I'm in practice in close to 20 years. You were doing this 40 years dentistry, and then many years of dedicating to the products that's I just barely know, investigate, and I see that it's have a significant benefit for my patient and my college friend patient, and also people around the world. So let's just talk about it, Dr. Berland. How did you started with this long journey? I listened to your podcast somewhere else, and I know that you start this journey not long ago, like years ago, before it come to the market for 4 years already. But years ago, you already put all your energy, and you were working on cosmetics dentistry, and you get involved with this, something that your passion, you want to provide and give out something good for people. Please share with us, like, how did you do that, and what drive you to this kind of invention or technology that you want to help people.
Well, just a little background. This is now my 51st year in dentistry. I
Wow.
started in high school working in a dental lab, and then I just gravitated towards dentures, and then I worked in a private practice as the dentist's personal denture concierge. There at the wax try-ins and everything, and that's really when I fell in love with dentures. Well, fell in love with dentistry because dentures were the original plastic surgery. Those little pieces of plastic do more for a person's face than any facelift or nose job will ever do. I mean, you basically reconstruct the whole bottom half of the face.
That's
And I
right.
couldn't believe when, these people would come up with shriveled little faces and then they'd be beautiful as soon as we put their teeth in. And I noticed, back then that a good looking denture always seemed to fit better than a bad looking denture.
Yeah.
And anyway, so that's why I went into dental school. It all started because I come from a family of bad teeth and denture wearers. And they pushed me to go into working into dentistry because they thought it would be a noble thing to save teeth or replace teeth. And it turned out just great for me. So then after I went to dental school, I was practicing in Dallas, and this was the beginning of the cosmetic revolution. It was the 80s. It was bonding. It was porcelain veneers. Then in the 90s, it was bleaching, and I wasn't seeing a lot of denture patients at that time. I was seeing, more fixed patients, and then bleaching came out. And this is before your time. You can't imagine how revolutionary bleaching was in the early 90s. And suddenly, I started seeing these very wealthy society women from Dallas for dentures. To whiten, they wanted to bleach their dentures. And what happened is in West Texas, back in the 50s and 60s, they had fluorosis, and a status symbol was to get your teeth removed and a good looking A1 denture. And then these people never went back to the dentist. And so when bleaching came out, she wanted to bleach her denture. I said I couldn't do it, but but we can make whiter teeth. And while we're at it, your dentures are worn down. We can change the shape. We could change the length. And actually, that was the birth of my Smile Guide, which is now available on denturewearers.com under a section called Choose Your Smile, which is really helpful for people, whether they're looking for veneers, fixed hybrids, dentures, any kind of full arch smile design. But anyway, so I always liked to do dentures. And then in 1999, Block Drug was acquired by GSK. And basically, they were bought for Polydent. And this was a over 60-year-old technology. And I was going, wow, I know these products are not that good. I know the zinc in the adhesive is dangerous. I know their soap cleansers really don't do anything except for deodorize, and they don't even deodorize that well. I should start working on a denture products because, I always listen to my patients, and basically all my products came from my patients. They said, why don't you come up with an adhesive that, fights dry mouth? Why don't you have a toothpaste that we can use in our mouth and on the denture? How about wipes? How about a real denture toothbrush that we can use in our mouth and on the denture instead of cleaning grout? How about a cool sonic cleaner that we could fit 2 arches in and has a timer? So basically everything that, I came up with, it came out of my patient's mouths so I could put it back in their mouths. So yeah, it was something that in 1999, 2000 or so, I started working on these products. And I didn't realize at the time how many barriers there are. Anytime you say on a product, it's a denture, it's classified by the FDA as a medical device. Whereas if you say it's a mouthwash or toothpaste, it's a cosmetic.
Huh.
It's a little more complicated. It's not like it's a heart stent or anything, but it's more complicated. And then the labs I was using, I had to find different labs. But anyway, every product we did, we'd go through evolutions, we'd give questionnaires, and then we'd go through generations. And then it was about 2015 where we got the products to the patient's liking. And that's when we went for the FDA and then later the ADA seal.
Wow.
That was a lot. Did I talk too much?
No, it's beautiful, Dr. Berland, because people like us, especially dentists, we we most of us, the school, whatever school teach us, we use it, and we are very close-minded people. We don't we are not we very dentists have, sometimes we have very little creativity in our mind, and even when we have something, we don't know what to do, how we're going to get there, and help our patient. But in your case, it's beautiful, and it's really appreciated that you invest your time, your effort, and you listen to your patient, and you really want to do it to change the world. And that's why I have an honor to speak to you, because most dentists just work, 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 and if we don't have, if we cannot make the patient happy, we just get mad ourselves, whatever, and then we just say this career is suck, whatever. We don't we don't want to be a game changer. We just want to be finishing the race, and then that's it. And that is most of dentists doing that, but you are doing the opposite. Is you stop the race and you bring the race higher level. So that's why it's
Well,
just
thanks.
different. Yes.
I mean, I was really just working in obscurity for 15 years on these products. And whenever I would mention it to any of my colleagues, they all said, "What, are you crazy? Why are you working on dentures? People are going to be, nobody's going to have dentures in the future." Boy, were they wrong. I mean, dentures are exploding.
Yes.
They're like, it's incredible. There's over 40 million denture wearers in America. That's more than all the people put together in Canada. And it's growing like crazy. And you want to know something else? They're
Yes.
not getting older, they're getting younger. 10 years ago, the first time denture wearer was in their early 40s. Now they're in their 20s, late 20s.
Yeah.
I see it all the time. There's all these Facebook groups, dating with dentures, dentures at a young age, dentures, we're here to help, dental implants, denture support group. There's tons of them, and they have tens of thousands of followers, and they have hundreds of posts every day. Um, it's just exploding.
So
They're
Dr.
coming out of the closet.
Dr. Berland, are you saying that American somehow the young age having more denture problem? They
Well,
wearing
they're
denture.
getting more dentures, yes. And there's a lot of reasons for it, I think. There's, of course, there's genetics, which is always, that's not going to change.
Hmm.
Uh, there's diet and education and home care. And I hate to say it, bad dental care. Um, but there's medications, both prescribed and illegal. And you know what? The biggest factor driving young people to dentures is cosmetics. I
Wow.
mean, I actually blame it on social media. I
Hmm.
go to these Facebook groups and I'll see young, dentures at a young age. I'll see all these good looking young people who have minor flaws
Uh-huh.
with their smiles. And I would probably not do anything but besides pulling their teeth and giving them dentures. I might give them a flipper, I might whiten their teeth, anything, but I wouldn't pull their teeth. But they're doing it and they're happy. And not only are they happy because they're showing these before and after pictures, but people are cheering them on. I think Instagram is driving a lot of a lot of dentures.
Social media, yes. TikTok, Instagram, all of that. Yep. Wow.
And these people, I'll tell you, there's going to be a tsunami of removable prosthodontics in the future because all of these young people that are getting dentures, they're all going to be needing implants later on.
Yeah.
I would advise most dentists, if you want to catch the future, I would learn extractions, implants, and removable prosthetics
Hmm.
because and fixed prosthetics too. But I think those treatments are going to just continue growing.
Right. It's amazing that, you know, when I look at your work done in the past, you've done so many cosmetics dentistry for fixed work. But on the other hand, you also dedicate your enormous time to help denture patient. So it's kind of like you are a very well balanced type of dentist. You're doing
Oh yeah,
cosmetics
I've done it
dentistry,
all.
but you also, you know, bring up to the edentulous people some hope, because in your podcast you talk to with other people, and a lot of information that you talked a lot about the issue that the denture patient have. They don't tell anybody. They don't even say to their spouse, and they suffering.
No,
And would you give us some kind of like, what are those issues that you heard directly from your patient day to day before you develop this kind of product, and what yeah, your solution for them?
uh, well, you mean the problems they have with their dentures or the problem with their home care?
Pretty much home
Uh,
care, yeah, home care,
oh,
yeah, yeah.
well, basically all of the denture adhesives out there dry out the mouth. And they even recommend that you dry out your mouth before, with a paper towel, which who wants to do that before you use the adhesive? And most denture wearers suffer from dry mouth, and it's very debilitating. And so our adhesive, one, it's got a different copolymer, so it doesn't require zinc. Because a big problem with the adhesives is they used to have so much zinc, and a little zinc is a good thing, but if you have it up in contact with the oral mucosa all day and all night, you absorb it at such a rate that it actually caused Alzheimer, neuropathy, digestive issues. That's why the stereotype of the denture wearer is a doddering old fool. And it was almost like the Mad Hatters in England, who, the mercury made them crazy. The zinc was making old denture wearers uncoordinated.
Hmm.
Then the other thing was, I told them they can't use toothpaste on their denture because it's too abrasive, and it would cause scratches that would allow microorganisms to colonize. So they said, well, why don't you come up with a toothpaste for the denture and for our mouths and for implants? Because we were doing a lot of overdentures. And that was our Cleanadent paste, which is half as abrasive as baby toothpaste. And it's got moisturizers like vitamins A, D, and E, aloe vera, coconut oil, tea tree oil. Whoops. There you go. And then we came up with a white version so that when people are out and about and they want to just clean their denture, clean their gums, they can just go to the restroom, use the wipe, and toss it out. Then we have a brush for the paste. It's ergonomic handle, extra soft bristle, and it's got a groove to capture the ridges and implants. And because of the unique bristle design, there's much less gagging if you brush your tongue. It's better than any tongue scraper, and it's great on the palate. Our toothpaste is the only ADA accepted toothpaste for fixed hybrids or all on four. And then we've got the silk cleanser that kills candida, strep, staph, actinomyces, E. coli, and more, which is really important. This is something that has been just, people don't talk about it because there was no cure. But a denture wearer is twice as likely to have pneumonia or thrush as a non-denture wearer. And if they sleep in their dentures, they're 4 times as likely. Why? It's because the candida, the staph, the strep that are already in your system, they congregate on the denture. And without cleaning, they spread. And so we came up with this silk cleanser that kills everything. In fact, when a couple of years ago, the ADA did a big article about me because we were the only ADA accepted denture products. And we were talking about the liquid crystal and thrush and pneumonia. And within a few weeks, I heard from a dentist in Seattle who told me that he always suspected that his dad died 30 years ago of pneumonia from his dentures. And when he read that article, it brought it home. And then I heard from a dentist in New Mexico her mom was having all kinds of stomach problems, and the docs couldn't figure it out. And she took her to the Mayo Clinic in Minneapolis, and they discovered that she had a massive thrush infection in her intestines that was traced to her denture. And her daughter's a dentist. So, people are just suffering, and they don't even realize it. Low grade thrush affects their taste buds, and it just becomes a new normal. So anyway, there was a huge need for these products, and that's why we brought them to the market. As I said, we didn't just like come up with them. We knew that I knew firsthand that this is what my patients needed.
Absolutely, Dr. Berland. Thank you for just quickly go over your product. One of the things that I like the ingredient of your product is they are very organic stuff. Would you throw out a couple of information about the material? I mean the ingredient of those liquid crystal or the paste. What I see that there is some vitamin stuff there, vitamin A, D, E, and oil and other
Aloe
stuff.
vera, tea
Yeah,
tree oil, coconut oil.
yeah.
Yeah,
Those are
we got a lot of stuff.
so health. So the ingredient is just organic stuff, and it's so nice to have something like this because when I gave typically when I give the denture paste into a patient, I worry that I don't know if these are a good product to recommend. But when I check your website, your product, the ingredient are very obviously friendly, and so
Yes, it's transparent.
yeah, it's so nice. So
Thank you.
I really encourage the dentists, you guys, check out the Dr. B Dental Solution to find out more about his product. Even just a toothbrush designed to clean the denture or the appliance. You guys should check out the video, the educational video, and you're gonna see that it's just something that we have to know in order for us to share with to our patient. Otherwise, we're gonna practice another year, another 10 year, and if we don't find out any new product out there can help our patient, we just working in the dark. So it's amazing. Dr. B. Berland, please share other information about what you have here.
Well, this is our website, and we go over all of our different products and all of our different kits for different treatments. Our reviews are phenomenal. We've gotten more love from customers and dental professionals in the last 4 years than Fixodent, Effordent, Polydent have gotten in the last 50 years combined. So anyway, just to summarize, we've got an adhesive, we've got a paste, we've got a wipe, we've got a brush, we've got a liquid crystal soap cleanser, and we've got the ultrasonic cleaner. And we make it in kits too. We've got the denture kit, which is good for everybody who's got dentures, partials, or overdentures. Then we've got the appliance kit, which is great for people who have retainers, aligners, night guards, and especially airway appliances, because our sonic cleaner fits both arches comfortably, unlike most sonic cleaners. Also, we've got a 5, 10, and 15-minute timer. So it's great if you've got a soft liner and you don't want it to, soak for more than 15 minutes. But yeah, this has been very, very highly embraced by dental sleep medicine docs. And speaking of which, this is something I just got back from the American Academy of Dental Sleep Medicine meeting in Dallas. And, everybody, this is like a big thing, dental sleep medicine, airway management. But everybody is focused on people with teeth. And yet the edentulous population, over 40 million people in the US alone, they all suffer from TMD and airway issues. And yet none of these doctors are focusing on them. And there's such a need because I go to these denture Facebook groups and people are talking about, oh, if I don't sleep with my denture, I snore, or I can't fit my CPAP on, or I wake up with headaches. And, a big problem with dentists is they tend to shun denture wearers. It's like they're not worthy of their treatment. And yet nobody needs us more than these people with, who are either partially edentulous, totally edentulous, or soon to be edentulous. I mean, that's what we're here for, is to help these people. And it's just I see this a lot, that dentists are not embracing these people who need us the most. And yeah, I've done a bit of a about face. I used to deal with, the fussiest patients who, would spend the most money for a little thing here, a little there, or whatever. And now I'm dealing with people where, they just want to have teeth.
Yes.
They just want to be able to smile. They just want to be able to eat. And a lot of them are on fixed incomes. These are the people who really need us.
Absolutely, Dr. Berland. I really appreciate what you have done in the past 50 years for the dentistry profession. Especially you are targeting helping out the denture patient, the dentulous and partial patient that, like you mentioned, most dentists try to walk away from them. They want to take care of something easier, but the denture patient are the one that they asking us to help. And fortunately now we have some products that you develop for years, not just recently, but for years.
Oh, yes.
You test out with your friend, you test out with your patient, and you got the feedback. They happy, and finally it's on the market for more than 4 years now, right? And so
Well, we launched our first product 4 years ago and our seventh product about a year ago. So we did, a couple products every year.
it's wonderful, Berland. I know it takes a lot of effort to get to where you are. I want to congratulate the work
Thank
that
you.
you do and your company. And we have about 2 minutes. Would you give some vision about your company? What you expect in the next 5-10 year or the future?
Well, it's a huge market that nobody realizes. Did you know that the denture adhesive and silk cleanser is over $3.6 billion in the US alone,
Wow!
and it's growing?
Wow!
Yes, it's a giant market. And that's with just two products. We've got 7 right now, and we've got more in the pipeline. And our products are better than everything that's out there. And I think that we are going to become a player in this market.
Absolutely.
Right now, we're not even 0.1% of the U.S. market, but people love our products. It's just a matter of getting the inventory and telling people all about it.
Thank you, Dr. B. We have less than minutes. I just want to appreciate again, and I want to shout out to your company, to you guys who watch this. And if you check out Dr. B Dental Solution, you'll be surprised that there is so much thing that you can really give a good service to your patient, to your community, and to your reality, and you will enjoy it. Dr. B.
If anybody would like to try our products, I'm going to offer everybody here a 20% across the board on your first order. We don't have a coupon code, so
Coupon
you'll call
code,
the number.
Coupon code my name.
Okay, cool.
Yeah.
Yes, perfect.
Yeah.
But yeah, well, I think you'll still have to